9 of 10 Americans consume too much sodium. Sodium added to food outside of the home accounts for more than two-thirds of the total sodium intake in the US. Too much sodium also puts you at risk for enlarged heart muscles, headaches, kidney disease, osteoporosis, stroke, heart failure, kidney stones, stomach cancer. Most of the sodium we eat comes from packaged, processed, and restaurant foods. Look for the heart check mark. In most products nowadays, you would see this logo, American Heart Association certified. When eating out, search before you go. Check your medicines. If you have high blood pressure, ask your healthcare provider or pharmacist about the sodium content of your medicine, including over the counter. Today's focus will be on sodium. And sodium, it's found in almost everything that we consume today. Is injected because of, sometimes, just to improve taste. But cumulatively, with everything that we eat, that, has a bad effect on our heart health. So break up with excess sodium. Our bodies need some salt for normal functioning. However, you're like most US residents, you're probably getting much more than your body needs, even if you never pick up a salt shaker. So even in the water we drink sometimes is infused. Over time, this can damage your heart and blood vessels, and it can be even put you at risk of a heart attack. Point one, sodium in your health. Did you know 9 of 10 Americans consume too much sodium? Sodium added to food outside of the home accounts for more than two-thirds of the total sodium intake in the US. Talking about outside of the home through the pandemic, unknowingly or knowingly, we have mostly depended on takeout and to make the food taste better or to appeal to taste buds. Salts are added in excess amounts. More than 70% of sodium consumed is from processed, packaged, and restaurant food. So your chips, some of the candy, even some sodas, some drinks, they do have high sodium content. Sodium in your health, sodium and your body. Your body needs some sodium to work properly. That is true. Too much sodium causes your body to hold onto water. This puts an extra burden on your heart and blood vessels. Most of the sodium we consume is in the form of salt. Reducing the amount of sodium in your diet can help you lower or avoid high blood pressure. High blood pressure is a leading cause of heart disease and stroke. So you think about it, too much of everything is not good. So you do need some sodium in your body for your body to function properly. Now, when you have too much sodium or salt in your body, you are giving your heart extra work to do. Your body's retaining water to dilute some of that sodium circulating in your body, and that leads to you feeling sluggish. Your heart is pumping extra fast to get all the sodium out. And over a long term, you will see the effects, some of us or some people may end up getting diagnosed with high blood pressure or heart disease of some sort. Too much sodium also puts you at risk for enlarged heart muscles, headaches, kidney disease, osteoporosis, stroke, heart failure, kidney stones, and stomach cancer. Diverse groups at risk. High blood pressure among Blacks is among the highest in the United States and worldwide. In the US, over 57% of non-Hispanic Blacks have high blood pressure. Among Hispanics, 44% have high blood pressure. Over 41% of Asian Americans have high blood pressure. And this could be attributed to, either food. We use a lot of seasonings in our foods, and some of the seasonings are very high salt content. So with everything contributing You use salt in your food while you're cooking. You add a seasoning cube, or sazon, or whatever else is customary to adding to your food. All these ingredients and all these flavorings have sodium content, and in combination it can be too much. So when cooking or when preparing food, it's good to have this at the back of your mind, that um, that most of the seasonings that we use in our foods do have salt content as well. How much is too much? Most adults consume more than 3,400 milligrams, which is 0.120 ounce of sodium a day. The American Heart Association recommends no more than 2,300 milligrams, that's 0.085 ounce a day, moving towards an ideal limit of not more than 1,500 milligrams, which is 0.053 ounces per day for most adults. Even cutting back by 1,000 milligrams, which is 0.035 ounce a day, can improve blood pressure and heart health. So this graph is just like a general idea of where the salt recommendations are. Average, this is what we consume in the gray. The recommended in the red. Ideal is in the blue. What's the difference between salt and sodium? Sodium is a mineral that is essential for life. Sodium helps your body work. It helps to control your body fluid balance. Sodium also helps send nerve impulses and function and affect muscle functions. Salt. Table salt is about 40% sodium and 60% chloride. So when you hear sodium chloride, this is what is usually the chemical name of salt. Salt and sodium are commonly used interchangeably. To find out the amount of salt in food, check the sodium content on the label. So, common sources of sodium. Did you know these 6 popular foods can add high levels of sodium to your diet? Breads and rolls, pizza, sandwiches, cold cut and cured meats. Salt is a heavy component in curing meat, is one of the most important part of preserving that meat so that it doesn't get bad, so that it can get to the consumer and have a long shelf life. Soups, canned soups, this is what is used to preserve the soups in the can so that it has a longer shelf life. It doesn't go bad quickly. Burritos and tacos. These are foods, you think of the processes involved in making these foods, like baking bread, pizza, things like that. So just when you're consuming food, just think about the processes involved in making them. Where does the sodium we eat come from? Most of the sodium we eat comes from packaged, processed, and restaurant foods. Processed foods are packaged in boxes, cans, or bags. Packaged foods are ready-to-eat, convenient items such as prepared meals, gravy mixes, canned soups, and cake mixes. Restaurants rely on some processed foods in their food prep. So 15% of sodium occur naturally, 10% is added while cooking, 70% comes from processed and restaurant foods. Common sources of sodium. More than 70% of sodium we eat comes from processed and restaurant foods. Packaged and prepared foods often have sodium added during manufacturing processes. Breads and cereal, cold cuts and cured meats, pizza, poultry, soups, and sandwich contain sodium. Some foods contain sodium in their natural state. Cantaloupe, potatoes, milk contain sodium in small amount. Bok choy, beets, chards have moderate amount of sodium. So naturally, some of our fruits and vegetables, because cantaloupe is a fruit, come with naturally occurring sodium. The same goes for sugar. So imagine either steaming, cooking any of these vegetables, potatoes. Some people cook their potatoes with milk, to make, a nice mashed potatoes. There's already sodium in potatoes, then you're adding the meal to it, then you sprinkle some salt into it, then maybe you add a bok choy or chard, just to, brighten it up. So think of all this sodium, in small amounts being added over time, they accumulate. We also add sodium during cooking at the table. Sodium is in products such as baking soda, seasoning blends, and also found in table salt. So seasoning blends, I talked a little bit about that. So, thinking about the baking process, you're trying to bake bread. You're using baking soda, or what else do we use? Baking soda. Just the condiments that is used in baking. Most of them have you know salt content. So in combining that, it adds up over time. Sodium on the nutrition fact label. Take note of serving size. If your portion size equals 2 servings of a product, you're eating double the sodium listed. Listed in milligrams. Look for soda and sodium and the symbol Na in the ingredients. So if we're looking at this food label, and some of us don't pay attention to this, especially with, sodas and, drinks. When you buy a bottle or a container of any item, it is important to pay attention to this serving size. We don't, some of us just eat everything at the blow. Just think about how much of everything that you're eating double or triple of. So I don't know what this item is, but it tells you the serving size here is 2/3. Two-third of the cup is the serving size. But most of us, if we're eating a can of soup, we eat the whole thing. So as opposed to eating 55 grams of sodium, if you eat the whole thing, you may double or triple the amount of sodium that you're eating. Also looking here, sodium here is listed as 160 milligram and 7%. Sometimes it's listed out as sodium. Sometimes it's used, Na is used. Other names are used. So just like is listed here, look for sodium, soda, or Na. So it'll help you have a good knowledge of how much sodium or salt you're consuming with that particular food. Reducing your sodium intake. Read the nutrition facts label. When buying prepared and packaged food, always check the sodium content on the nutrition facts label. Compare the sodium content of similar products. Choose the items with the lowest sodium. You know that you're going to eat a combination of things. Like this young lady on this aisle, she has a bottle of juice. So if she knows she's going to drink this juice with, a few crackers, be it saltines or graham crackers, and she compares the same flavor of juice through the brands, say about 5 or 6 brands in that aisle, and she sees that this particular brand has a lowest sodium content. It is advisable that you take the brand that has the lowest sodium content because of the cumulative effect of all the other items that you're going to consume in addition. Baking soda and baking powder also contain sodium. That's the other thing I was trying to remember. Baking soda and baking powder, often used together in baking, both have sodium content. So you might want to keep that in mind. Understanding food packaging. Sodium free, less than 5 milligram of sodium per serving, and contains no sodium chloride. Just because it says sodium free does not mean that there's absolutely no salt in it. It's just a lesser content of salt in it. Very low sodium. We see this on, food cans, like soup cans, 35 milligrams or less per serving. So pay attention to that serving. How much is a serving? Is it half the can, 2/3, a quarter of the can? Pay attention to that. Low sodium, 140 milligrams or less per serving. Again, pay attention to the serving size of that soup, and it tells you that it's 140 milligrams. Again, if you're having this kind of soup with bread or saltine crackers, pay attention to how much sodium you're consuming in combination. Understanding food packaging. Reduced or less sodium. At least 25% less sodium per serving than the usual sodium level. And sometimes This can be a very gray area because the usual sodium level has like a range, right? So it's between this and this, and companies can decide where they fall. So just please pay attention per the recommendation. Light is for sodium reduced product. The food is low calorie, low fat, and sodium is reduced by at least 50% per serving. That per serving is coming back up again. Just because your serving size is a whole can of soup doesn't mean that that's the serving size that the company, intends. So this is a tricky area here. Light in sodium, the sodium is reduced by at least 50% per serving. Look for the heart check mark. In most products nowadays, you would see this logo, American Heart Association certified. More and more companies are, working on starting to produce healthier food options and alternative for the everyday consumer. So just because this logo is there doesn't mean you're not still careful. Still read the logo, the nutrition facts label, and make the best decision for you. One of the four sodium limits applies depending on food category: up to 140 milligrams per label serving, 240 milligrams per label serving, 360 milligram per label serving, 400 milligram, 480 milligram per label servings, and per standard serving size. Going back to that serving size per product. For more information and a list of certified food, visit heartcheck.org. So American Heart Association, on their website, they do have heart healthy foods. If you're ever in doubt, say you wanted to buy a box of cereal, you don't know which is heart healthy, honey Cheerios, honey, why am I forgetting this? The Cheerios company, they do very well in advertising the heart benefits of their cereal. So this will help you kind of like have an idea of the kinds of products to look for when you actually go to the grocery store before you buy. It'll help you become a better educated consumer before you go to the stores. Healthy diet tips. Follow an overall heart healthy diet that emphasizes a variety of fruits and vegetables. So the one way I usually teach this to my patients is that I tell them to eat the rainbow. So in a given day, eat the rainbow. Have foods that basically cover the spectrum of the rainbow. Your greens, your yellows, your reds, your purple, your orange, you know, eat the rainbow, because each of these fruits, their coloration is the richness, in their vitamins, right? Pomegranate for the reds, you can eat like beets or eggplants for the purples. Green avocado falls in that category, broccoli, green apples, orange pepper, yellow pepper, oranges, even persimmons for people who eat persimmon, carrots in orange, corn for yellow. Just eat everything on the spectrum. It's an easier way to remember. Whole grains. Try to avoid white rice or overly processed grains, or flours. Low fat dairy product, skinless poultry and fish. I know that we like that fatty juiciness that the skin gives the chicken is not healthy. Sorry. Nuts and legumes, non-tropical vegetable oils, limited saturated fat, trans fat, sodium, red meats, sweets, and sugar drinks. When cooking at home, resist the temptation. Use less salt when cooking and seasoning. Yes. Try the food first. Don't salt your food before you taste it. And even if you taste it and you feel you need salt, sometimes it takes a herb to basically brighten your food. There are a lot of, herbs, we're talking basil, thyme, Even sage, different things can help brighten the flavor of your food. You may not necessarily need salt, but because sometimes our taste buds are just, looking for that, saltiness, is not always good for you. Even if you have it and you feel it tastes good, it's not good for your body. Um, be free. Try salt-free seasoning alternatives, please. Be adventurous. Use herbs, spices, vinegar, fresh lime, lemon juices to add flavor. I jumped ahead, guys. I'm sorry. I spoke too fast based on experience, but lime, lemon, they brighten foods. Use spices. Please be adventurous in trying different herbs, different vegetables, just to see how things bring out different flavors in food. When eating out, search before you go. Lots of restaurants and fast food chains have nutrition information on their websites. This is true. A lot of people are starting to cater to the need of customers who want to be healthy. Even Chinese food have healthy sections now. So if you want, a healthier meal, not the fried rice and the fried chicken and all that stuff, the steamed alternative, steamed vegetables, steamed chicken, steamed shrimp. Please look at those and make the best decision for you. Look for clues. Look for healthy designation or symbols on the menu. Yes. Have it your way. Request that your dish be prepared without added salt and high sodium ingredient. And this is very much a thing. Don't feel that you're asking too much. Don't feel it's an inconvenience. It is your body. You only have one. And if you dump this out, it's going to be a hard road to recovery. If you're going to a sit-down restaurant, ask for a healthy menu. If they don't have one, when you're ordering, ask for low sodium preparation of your meal. It is okay to do that. Check your medicines. If you have high blood pressure, ask your healthcare provider or pharmacist about the sodium content of your medicine, including over the counter. This is why you should not take over the counter, especially if you're on prescription medication, without your doctor knowing about it. Sometimes this medication interacts. Sometimes, you're on Lasix trying to lower, the fluid that your body has collected over time, but you're taking a medication that is very high in sodium that is dumping that right back into your body. So it is very important that you discuss with your doctors, your pharmacists, all the medication that you're taking, and ask questions if any of them interact or counteract each other. Read the labels before buying over-the-counter drugs. Ask your pharmacist if there are low-sodium alternatives available to medicines you may be taking. Always ask. It's not too much trouble. This is what these people are there for, to help you, to assist you. I don't have a pharmacy degree, and I don't want to act like I know what a pharmacist does. So I ask questions. Even as a nurse, I ask because this is their area of expertise. They can tell me what I may not know. They may recommend alternatives, and I can discuss that with my doctor. So please always ask. Please always have a conversation. When they ask you at the pharmacy, when you pick up your prescription, do you have any questions? Please say yes. Does this interact with anything? I'd like to talk to the pharmacy, get that clarity and knowledge.
Thank you so much, Edith. That was amazing. Thank you for that awesome presentation.
Thank you.
I think if we can all remember that the most important thing you were saying is about serving size. We get a lot of, especially in the United States, everything is supersized. So you may think that a bottle of soda is just one bottle and you're going to drink it, and it's actually 2 servings in there. Or a can of soup, it's usually for two people. So that is very important for us to keep in mind when we're looking at the sodium content in the products that we're consuming. That was very great information.
How much salt? How much salt? How much sodium is in a, let's say, a teaspoon of salt? A teaspoon of salt.
So a teaspoon of salt, please help me out here, Maria. So a teaspoon of salt will be like the amount of sodium I think that is recommended for the whole day, which is about I forget what's the graph. I think it was like the 2300. But it's difficult to measure that because you cannot dump the salt in your soda into a teaspoon. You cannot dump the salt in your soup into a teaspoon. So the one thing to do, which can sound tasking but over time would become second nature, is to keep an eye on the sodium content of everything you consume, right? So the one thing that I used to tell my diabetics when I was doing diabetes education is that get in the habit of writing down everything you put in your mouth. Because when we talk about food, people put it to breakfast, lunch, and dinner. We don't calculate the hard candy that we have between the day. We don't calculate the salty caramel candy that we have. We don't calculate the soda that we had with the meal, or even the tea we had at breakfast, right? We don't add that. We just focus on, oh, I want to write down what I ate, but everything adds up. So if you get into the habit, at least for a week, of saying, okay, so I have a can of soup for, say, a light lunch, right? And this can of progressive soup, no shade, this kind of progressive soup has, this amount of sodium in it and is for 2 servings. Okay, what exactly is 2 servings? Can I split this in half and see that it's equal, right? And you're like, okay, this is 2 servings and this is the amount of sodium. You write that down. I drank this. I had a caramel candy or two, or I had a bag of Skittles, or I had saltine crackers for with my soup. And saltine crackers says I have the serving size for saltine crackers is like 2 crackers or 3 crackers, I think, some ridiculous number. And this is the amount of sodium in that, and you keep that in mind. Over time it will become second nature. Like, okay, I've already had this much sodium in the day, I don't think I have room for any more. And when you also cook, keep that in mind. African foods, can be heavy in salt for cooks who don't know how to cook. But the ways to go about it, the ways to go about it, the ways to flavor our food. We use a lot of vegetables. We use a lot of herbs. That will brighten your food as opposed to you thinking, oh, I need salt, I need salt. That's why I heavily cook with basil. If I use my 1 bouillon cube and I'm making this big batch of soup and I feel like, what, I still need salt, I'm like, where's my basil? And that offsets that need to, and these basil has a naturally occurring salt content, sodium content rather, as well. So everything adds up, from seasoning the meat to seasoning the fish and the fish that was cured in salt to dry, and everything adds up. So it's difficult to kind of say, oh, a teaspoon. You're not walking around with a teaspoon and dumping salt into it to see how much, you're going through. And when it comes to measuring, if we can invest, or anybody can invest by going to the dollar store and actually buying measuring spoons, that is the best gauge. You buy a measuring spoon, you scoop it up and you flatten it out, right? A teaspoon you used to eat, or a tablespoon you used to eat, is not going to really give you an accurate measurement. So
Yeah,
please spend
it's
a
not the
dollar.
same. It's
Not the
not the
same,
same.
not at all. You know, get that measuring. They come like in a set of maybe about 6 or 7 of them. Going from teaspoon, half a teaspoon to tablespoon, half a tablespoon to 1 cup. If you can get a hold of one of those plastic things, that is a really good way to measure.
Those are very good points. The recommendation is about a teaspoon, but there's a lot of hidden salt in a lot of our foods. So we have to make sure that we take those into account when we are keeping track of how much sodium we're taking. Because you can say, okay, I'm going to add this 1 tablespoon to my rice, but you may be having vegetables and then you're sprinkling salt on that, or drinking something that has sodium in it. So it's very hard to keep track of, but if you can take account for everything that you're using, it will be very helpful.
Right, right, and also your drinks, that hidden salt in the drinks. Gatorade, so many people use Gatorade, Powerade to work out, to replace electrolytes, but they have in salt. Sodium is part of that healthy family. But you drink Gatorade to work out, then you come and have an omelet for breakfast, which is healthy, but the omelet had salt sprinkle on it. Then you had a parfait or something, and later on it adds up through the day. So that's why it's good to take account of everything you put in your mouth, not necessarily just food. So it is hard to track of, but to keep track of, but is a habit worth building, I would say.
Thanks so much. I think we have two, I see two questions, and they're somehow, I think, interrelated. There was a question for additional tips in terms of reducing kind of the dependency or the use of sodium without sacrificing flavor. But it's linked to the next question in the sense that our taste buds or our tastes we used to certain level of certain taste. So how do you kind of rebuild the habit while making sure you don't go into what might be called withdrawal or something like that, because that sometimes breaks the progress. So yeah, I wanted to kind of maybe hear your take on that, and maybe some additional tips that you might have.
So, flavor is very important because
Right.
the one way to that we enjoy food is to flavor. But there's so many other things that can give flavor to your food. For example, she already mentioned herbs, but you can do like if you like spicy, like peppers, onions, vegetables. All of that you can add. You can make your own broth at home, and that way you can control how much salt is going into that. And just adding your own spices, you can substitute, instead of putting salt, you can use cumin or turmeric. All of these things can add flavor to your food, and paprika. So go out there and look for natural herbs and spices and substitute them for salt.
So everything she said, and then this. Um, the brain is a beautiful thing and a wonderful thing. We can train a brain to do anything. So if you're worried about withdrawals, people quit smoking, people quit alcohol, right? People quit drugs. Is what you train your brain to do that your brain will get used to. It's that emotional attachment that we feel, oh my goodness, I'm going to die if I reduce my salt intake. If I don't use 5 Knorr cubes in my soup, it's not going to taste great. That's a lie. We've come to, okay, this is what we're used to. It's kind of like Hollywood divorce, when they're divorcing, I want 50 million for my monthly allowance because this is the life I've been accustomed to. It's a lie. You can adjust, right? Whatever you tell your brain is what your brain is going to believe. Think about you as a person. You've grown to acquire skills. You've gone to school. You've learned things. You've learned skills as a job. At a job, you've learned how to walk, crawl, talk. Right? All of that is training your brain. So the more you expose yourself to alternatives and understanding that these alternatives are equally as good, the more you're going to come away from that addiction to salt. So what you tell yourself is what will happen. If you're bent on doing it, you'll be successful. I know it can be terrifying. Lifestyle change is not easy, but you have to commit to it if you know it affects your health and you want to be healthy. That's the psychology of, being.
Yeah.
It's not easy. I will not say it's easy. It's not easy, but it takes work. Every good thing that comes to anybody requires effort. And if you put your effort to it, you explore flavors like Maria said, go out, spicy foods, if you like a little spice, add a few things that give you a little kick, paprika, even habanero peppers, like the Nigerians use tatache, or, for Hispanic culture, there's, what do you call it? There's jalapeno, and there's, the other pepper, I forget what it's called.
Sriracha.
Yes, explore flavors, explore different things. You might even surprise yourself. So don't let your addiction to salt or high salt food, high sodium food deter you from being healthy. If you tell your mind you want to be healthy and you're conscious of it, that addiction who, salt who, you'll forget it very quickly.
Okay, so another question that we have here for you guys is um, I know we put in the chat, but does salt affect kids and teens the same way?
So, like we said earlier, sodium is necessary for life, right?
Hmm.
However, too much sodium is not good for anybody. Unfortunately, in the United States, this is the first century where we have started to see children being affected by diabetes and hypertension. Um, we have so many children who are now being monitored for high blood pressure, and 10 years ago, this was not something that we used to do. And it's all because of the culture and the food that we eat and obesity in the United States. And sodium affects them the same way it would affect an adult. So if your child is overweight and your child is eating a lot of sodium, they can retain fluid and they can have higher blood pressure. So it's something that we don't just want to give it to them freely, and we want to teach them at an early age about eating the rainbow and eating healthy and having an active lifestyle.
Awesome. And are schools currently tackling this problem, or where are parents and students usually hearing about this?
I hope that the schools are teaching that, but what I say is it all starts at home.
It all
You
starts at
know,
home.
you
Yes.
have to teach your kids, um, consume things in moderation. Unfortunately, um, the school lunches, they're not checking how much your kids are putting on their tray. And so they are, consuming extra sugar, they're consuming extra salt. I think they may mention it in health once or twice, but it's not something that's monitored. So it's something that you really need to discuss with our teens and our children so that they're aware of the choices that they're making at school.
Yeah. Just to add to that, First Lady Michelle Obama, this was her initiative for schools, the 8 years she was in office, and it caused a lot of uproar where parents, some parents, not all, accused her of trying to control children, let children be children, define the children, that whole Let's Move initiative. You think about it when kids are in school, they go out for recess for what, 30 minutes? And most of the time they're sedentary, they're sitting, right? Or they move between classes for the little older kids. So, going back to what Maria said, it starts at home. Sometimes we don't always have time to prepare home cooked meals for our kids, and we depend on the school lunches. Teaching a child how to read labels, teaching a child how to make good food choices. I am fortunate enough that even with the school lunch that is provided here, I'm given a menu and I have to make that choice. And I'm able to sit down with my 9-year old and we can go through the food choices and decide, okay, we're going to get a combination of this and this and this. Why are we doing this? Because these are healthy, right? We are in an era where we're in the rat race of going 24/7. So McDonald's, Wendy's, and Pizza Huts are uncles and aunties' houses that feed the kids 24/7. You know, and not please if anybody works for Pizza Hut, I'm sorry. So it's like that. Even Caribbean restaurants or African restaurants. Um, I had a friend one time that we went to. I don't know anybody's familiar with New York City. When we went to an area in Queens that is predominantly Asian, and we went to it wasn't even like a big restaurant. It was just one of those restaurants that they take out. And when we had food there, she's like, this is very different from the Chinese food in Brooklyn and Bronx. I'm like, yes. It's like, what happened to the people? Do they forget to cook when they get to the black neighborhoods? I said, no, they're catering to the taste buds. right? So they dump salt into it because you know what? People here want the salty foods. And we wonder why our community is going through this crisis of heart disease and high blood pressure. You know, some of these cultures, they do know how to flavor foods with herbs, ginger, you name it, right? But because it's a business, they have to thrive, they have to make money. They feel they have to cater to the taste buds. And these are the restaurants where if mom is working until what, 4 p.m., 5 p.m., when a kid gets off from school, they go to the Chinese restaurant to get something to eat until mom comes home. So there's a lot of factors, that add to what Maria said we're seeing now. It goes with activity. It goes with the school lunches. It goes with the ready-made foods that are readily available for the children, and it goes with ready-made foods that are readily available for the family. Because if I get up work at 5 and I get home by 6 or 6:30 p.m., I don't want to cook every night, right?
Convenience, right?
Convenience. So,
Yeah.
and everything is supersized. Maria mentioned this, and it makes us even happier. So there's a lot that's contributing to that. Our lifestyles and the food choices available, and lack of education and understanding. I would say that.
Awesome. Thank you so much. That was a very
Sorry, I
good
took too
answer.
much time.
No, no, no. Another question that we have is how does stress contribute to high blood pressure? So I know we kind of talked about this previously,
Right.
but something that comes to mind is like anxiety eating and stress eating. So I'm sure you guys have your medical standpoint on that.
So again, I think we had mentioned about our body has this flight or fight or flight. I sorry, the word just left my mind. Fight or
Response.
flight response. So what happens is we're in a state where our body is just like stressed out, so everything has to work harder. And sometimes, when we're stressed out, we do eat more, and then we will choose comfort foods, which tend to have all of the foods that we should stay away from that are high fat content and their high sodium content, because it comforts us, but it also has secondary side effects to that. So stress can, make some people eat more. It can make people feel more anxious, and all of those things can contribute to, like we said earlier, heart disease, obesity. So it's recommended that we keep stress at a low level. And when we're anxious, again, that increases our blood pressure. um, and it can do so much damage. It's like it's such a broad topic that I could be on it for hours. So but it does affect your blood pressure, definitely.
The principal idea here is to reduce or keep stress low, but in reality, there's not much you can control. I think people should keep that in mind. Um, work will stress you out. You cannot control that, but you can control your response to it. So self care is very important. Listening to music, even if it's like traditional music or music from other countries, or just having a dance party, a solo dance party, it's okay. Self care is very important. Not all of us can afford to have massage every weekend, or therapy session every weekend, or whatever it is. But just taking time to yourself, soaking in Epsom salt, just understanding I only control how I respond. Because I don't know, Maria, you've heard about this, that uh, is it 90% of what happens to us is how we respond to things, not really that thing. So the thing that is
That's
stressing you out, be it your crazy boss at work, or your workload, or even dealing with life in general, balancing kids, life, home, school, whatever it is how you respond to it. That things that you can't control, how somebody perceives you, how somebody treats you, that's, as long as you're a good human, keep it here. How am I going to respond to this? Because my response is going to affect every system in my body, right? Including my heart, my brain, my nervous system. It affects digestion and things like that. People get stuffed up when they're stressed and wonder why. So just controlling how we respond to things and self-care is very important. Is very, very important, please.
Thank you so much. We have one time for one more question. If I lower my sodium intake, what improvement should I expect to see in my blood pressure? And tagged along with that is, how long does it usually take the body to adjust?
If you lower your sodium, your blood pressure will be lowered as well, because again, sodium contributes to the fluid in our body, right? So the less fluid you have for our bloods to be pumping, the lower your blood pressure will be. What was the second part of the question? How long?
How long does it usually take the body to adjust?
Well, it's different for everybody, but it depends how much sodium you're taking in to begin with. So if you're somebody that's like eating a bag of chips 2 or 3 times a day, you're having soda, and you consume a lot of salt, right? It's going to take a little longer than somebody who has a much healthier lifestyle and food choices. So it all depends, but you should be able, if you have like really high blood pressure, the first thing that we try to do is to decrease the fluid overload in the body, right? So if you're helping by decreasing the sodium, that of course is going to get your blood pressure to come down some, right? So it's a first step that we always try to do, is to decrease the sodium and do lifestyle changes.
Many of you know that I'm a heart failure patient, and I've been. That was one of the first things I had to learn about my journey, was to control the salt intake. And I think Idong mentioned taking Lasix, which is, I feel, for me, was the miracle medicine. It just removed the fluid out of your body, which means that you have to go to the bathroom many times, but that's another story. Um, but I could see the difference in me in just a few weeks, in terms of the weight. First, you just feel lighter. The salt being out of your body. Our body retain a lot of fluid. Our body is made of a lot of liquid. So in this case, for me, it was very helpful to help my heart feel better, but I could breathe better. So it was affecting my breathing. And then, all of that can affect everything else, right? So I was more active, I was healthier, more productive, less moody in the house, and then so on and so forth. So to your point, it's different for everybody. But for me, I could explain that it's like day and night. So I could see, when I don't eat well, I can see it in my body the next day. Sometimes, you'll gain 1 or 2 pounds right away, and sometimes you gain 5 pounds. And then by just eating well, I remember this was 3 years ago. Just changing my portion sizes, watching my portion sizes, and eating much healthier. Let's say in a matter of a week, I will lose like 5, 7 pounds or so, without doing anything extra in terms of gym or anything like that. So I just want to say it improves your health, saves your life, but also definitely impact a lot your quality of life. For those who don't, we just want to say try it. Really break up with salt, watch it, and I'll probably end over. And we're over time, but I'll give everybody a chance to close up. But my last words would be that we also need a strong support system, right? So in my case, depending on when you're patient, you might have people cooking for you, including, you mentioned, aunties and then families. In my case, I think when I was really, really sick, it was my father-in-law, which was special. So we call him Pepe in the house. So I want to give him a shout out for that. But then, yeah, in a short period, eating well just got everything in under control.
If you don't mind, somebody said something. Meme Joyce, yes, absolutely. You can lose weight by not reducing your salt intake. Remember that. It's like, not to get all sciencey on you, it's like the process of diffusion and osmosis. What happens is that when you have a lot of salt in your body tries to retain a lot of fluid to try to dilute that salt. The medicine that Bouba mentioned, that I also mentioned, a little bit is Lasix. It helps, just get all of that water out. So your body is struggling to keep you alive because there's just too much of what it is that you need. Too much of everything is bad, whether it's something that you require or not, right? So if you reduce your salt intake, you'll be surprised how much weight you lose because all that water makes you puffy, makes you gain weight, and you feel sluggish. So when that water comes out, you feel so much lighter, you know, just vivacious. Just try it. It can be difficult. It's not easy to change something that you're used to, but I believe in every single one of you. You can do it. Me included. I can do it.
I wanna go back, I want to, but time carries on.